Welcome to The Explainer. Today, we're going to go behind the surgical mask and talk about someone who, literally holds your life in their hands during an operation, the anesthetist. And we're going to dive into the gripping first year of their training, a journey that takes them from just knowing the books to having real life-saving expertise.
Okay, so when you go under for surgery, you're hooked up to this incredible piece of technology, the anesthetic workstation. You can think of it as a super sophisticated life support system. It's the machine that's controlling this really delicate mix of gases and oxygen, and it completely takes over the job of breathing for you while you're out.
And then you've got this screen, right? Look at those waveforms. That is your lifeline during the whole operation. Every single peak, every valley, every number on that screen tells a story in real time about how your body is handling the stress of surgery. It's just this constant flood of data, and someone has to know exactly what it all means.
But here's the crucial question, right? Who is actually watching all of this? I mean, the technology is amazing, but it doesn't make the decisions. The person who's interpreting all this complex data, making these split-second, life-or-death calls, that's a highly trained expert. And their journey, from being a fresh medical graduate to a skilled anesthetist, is forged in this incredibly intense first year of training.
All right, so let's get right into the first major hurdle for every single new trainee. And it's this huge and, frankly, pretty dangerous knowledge gap. It's this massive chasm between all the theory they've spent years learning and the practical, on-the-spot decisions they have to make to keep someone alive.
So you have these trainees, right? They walk in on day one armed with just mountains of knowledge from textbooks. I mean, they've studied this stuff cover to cover. But here's the problem. And this comes from anesthetist Dr. Lachlan Rathe, whose work actually inspired this whole explainer. Those books, they're completely silent when it comes to the most urgent, practical questions that pop up in the OR.
And this quote from him really gets to the heart of it all. See, real-world anesthesia is a completely different beast from what's in the textbooks. It's not just about what you know. It's about what you can do with that knowledge when a person's life is on the line and everything is changing moment to moment.
I mean, just look at some of the questions these trainees are wrestling with. What are the criteria for extubation? Or how do I manage an LMA with a leak? That's a type of airway device, by the way. Or this one. When do I cancel a kid with an upper respiratory tract infection? And how do I intubate someone without muscle relaxants? These aren't, some abstract puzzles. These are real problems happening right now that need answers based on experience. Answers you're just not going to find in a textbook. So how do they bridge that huge gap? Well, the answer is a process you can really only call a trial by fire. This is where the real learning starts, on the job, in a live operating room, where every single move you make has immediate consequences.
Yeah, this is not classroom learning. Anesthesia is traditionally taught through this old-school apprenticeship model. We're talking about a high-stakes, one-on-one mentorship. You've got the trainee, a senior supervisor, and a real patient in a live operating theater. There are no do-overs, no hitting the reset button. The responsibility is just immense, and it's immediate. And as you can probably guess, the learning curve is incredibly steep. Mistakes are going to happen. Dr. Raffi points out some really common and, let's be honest, terrifying first-year errors. I mean, can you imagine forgetting to turn on the anesthetic gas? Or not testing a regional block before the surgeon starts cutting? These aren't just hypotheticals. These are the kinds of mistakes that actually happen, and it just shows you why having that constant vigilant supervision is so critical.
But here's the incredible part of the story. From the flames of that trial by fire, a completely transformed doctor emerges. In just 1 year, that trainee goes from a novice who's full of questions to someone who's really starting to master a life-saving craft. It's just a remarkable journey of growth.
Think about that. In just 12 short months, that trainee goes from pure uncertainty to confidence. And they're not just learning procedures, how to do things. They're developing the critical thinking skills, the composure, everything they need to handle the immense weight of keeping a person safe through surgery.
And by the end of that first year, they're trusted to independently manage the anesthetic for a whole range of procedures. We're talking emergency C-sections, appendectomies, laparoscopic surgeries, even major fracture repairs. Each one of those is its own unique challenge, right? It's this complex dance between drugs, the patient's body, and pure hands-on skill. And a huge part of this mastery comes down to a set of really specialized hands-on skills. Dr. Rathe actually calls bag mask ventilation the single most important skill. That's the basic fundamental ability to breathe for a patient. But then there's so much more.
The fine motor control you need for spinals and epidurals, the skill for putting in arterial and central lines, gas induction for kids, even being able to perform a surgical airway if everything else fails. These are the literal tools of their trade.
Okay, so all of this training, all of this intense experience, it all leads to one profound, ultimate lesson. The most important piece of equipment in that entire operating room, the real guardian watching over the patient, it's not a machine. It's something way, way more powerful.
And this quote really says it all. The best and most important monitor is a vigilant anesthetist. You know, in this age of unbelievable technology, with all the bells and whistles and alarms, the ultimate safety net is still the human expert. See, a machine can only react to a problem. A vigilant anesthetist, they can anticipate it. And that is a world of difference.
As Dr. Rathi says, your brain is just better than the most expensive machine in the world. And you should never forget that. Think about it. The anesthetist's brain is the ultimate supercomputer in that room. It's taking in everything, the data from the monitors, what they see in the patient, what the surgeon is saying, and it puts it all together in a way no machine possibly could. It's that human intuition that can spot the tiny, subtle signs of trouble before an alarm even has a chance to go off.
So here's something to think about. The next time you, or maybe someone you love, is the one counting backwards from 100, who are you really trusting? Remember this whole journey. Your trust isn't just in all those fancy machines. It's in the person who's watching them. It's in the culmination of that incredible, year-long trial by fire that turned a doctor into that unseen, vigilant guardian whose only job is to make sure you wake up safely on the other side.